Let's look at a procedure called a Percutaneous Endoscopic Gastrostomy Jejunostomy Tube Insertion. This is causing coders some trouble because I've gotten several questions on whether or not this is a bypass procedure. The title of the procedure is ostomy, but in this case it is not a bypass procedure. It's the insertion of a specific device called a feeding tube or a feeding device. So when we code these, we code this to the location of where the tip of the tube comes to rest. These typically get inserted into the stomach or the jejunum, but the 0DH table for insertion allows us to code placement in multiple different places in the GI system. This is what one of these tubes look like once it's inserted. The physician's going to call this a percutaneous endoscopic gastrostomy, or a PEG, and the title of the procedure is where some of the trouble starts. The endoscope does not deliver the tube through the skin. The endoscope only assists. So in ICD-10 PCS, the approach here is percutaneous, not percutaneous endoscopic. And so this is coded to 0DH63UZ. So then the jejunostomy is the next question. Well, this is a tube, just like the gastrostomy tube, that goes through the skin but directly into the jejunum this time. And in this case, it's not an endoscope that helps, it may be a laparoscope. But again, the laparoscope doesn't deliver the tube through the skin, it just assists. So this is also a percutaneous approach, coded as 0DHA for jejunum, 3UZ. So then what is a PEG jejunostomy tube? Does that mean that the patient just has two tubes? Well, yes and no. They do not have two independent tubes. There's no two separate insertions. This is a gastrostomy tube first, but it's a special tube that has space for a jejunostomy tube to be placed through it. So first, the gastrostomy tube is placed, and then the long, thin jejunostomy tube is threaded through that tube and into the jejunum. So this has a different approach. We need to think about this as a percutaneous gastrostomy and then a jejunostomy that is done through an artificial opening that was just created by the G-tube. There are two different tip locations here, stomach and jejunum, and there are two different approach values, but there's only one stoma created into the abdominal wall. So this takes two codes to accomplish this. It's the 0DH63UZ for a gastrostomy, but then the second code is 0DHA7UZ because it went through an artificial opening. For help with questions like this, consider the Pediatric Coding Suite from Libman Education.